Hi, I'm Lori Smetanka with the National Consumer Voice for Quality Long-Term Care, and welcome to today's episode of Pursuing Quality Long-Term Care. In March 2020, as COVID was beginning to spread through nursing homes at alarming rates, and we were seeing how deadly this virus was for residents, the federal and state governments issued orders to severely restrict who could enter facilities. As a result, all visitors, families, friends, members of the community, long-term care ombudsmen, and other advocates, everyone was prohibited from entering. Virtual visits were offered in some places, but that was not a viable option for many. At the same time that the visitation restrictions were put into place inside the facilities, residents were required to stay in their rooms, often with their doors shut to the hallways. Their meals were eaten alone in their rooms, and they had very little contact with others. The residents became very isolated. So not long after the restrictions were put into place, our special guests that we're going to be talking to today decided to survey residents of nursing homes and learn more about what was happening with them and what the impact was of the changes that had been put into place due to the pandemic. The results of that survey provide a look at that impact and the toll it has taken on the physical and emotional health of residents. So our special guests today are Anne Montgomery and Sarah Slocum. They're the co-directors of the program to improve elder care at Altarum, a nonprofit research and consulting organization that creates and implements solutions to advance health among at-risk and disenfranchised populations. They both have very distinguished backgrounds. Sarah is the former state long-term care ombudsman from Michigan, worked at Michigan AARP, and has been very active in policy and advocacy activities, both in Michigan and nationwide. And Anne was also a previous senior advisor for the United States Senate Special Committee on Aging, was an analyst for the Ways and Means Committee in the House of Representatives and the Government Accountability Office, and has extensive experience working on Medicare, Medicaid, and related programs. I think if I read both of your full bios, we'd be here for the entire time. So we abbreviated just a bit, but it's great to have both of you joining me today. Welcome.
Good morning. Thank you for having me.
Glad
Yes,
to
good
have
morning.
you. So what do you think initially the visitation ban meant for nursing home residents and your families and their families? Why were you interested in, thinking about where else to go with this and to start, thinking about the need to do research in this area?
Well, I'll start. This is Anne. Hi, everybody. And I would just say that we were very concerned talking to people like you, Lori, and many others around the country to hear that, family visitation had been effectively, cut off, prohibited for the most part at the national level as of March 2020. And so we really knew that residents, or thought we knew that residents would not do well if the isolation continued over a period of time. And at that time, of course, nobody knew how long it would last. So Sarah and I talked about it, and we talked about it with our colleagues, and we thought, what can we do to really address this? What would be meaningful and impactful? And we did come up with the idea of doing a survey of residents themselves and to get their voices. So we set out to do that, and we posted it in July online as an online survey. We ended up with 36 states and 365 residents who responded. And that was really due in part to the distribution that we had with Consumer Voice, Ombudsman, Leading Age, AHCA, many other partners. And we heard a lot from residents about really what their direct experience was. So I'll stop there and let Sarah provide her thoughts too.
Yeah, so in March of 2020, in addition to family members not being able to visit, we were concerned about some other environmental factors that were going on, like surveyors were only doing infection control related surveys. So that's another set of eyes and ears that was very scarce at that time in nursing homes. And there were certain types of data that CMS allowed nursing homes to stop providing timely for a while. So there were numerous ways that nobody was seeing what's going on inside those walls. We started, as Anne said, talking about it internally and figuring out how could we possibly address this. We were also at the same time watching the publications, watching the literature, and we noticed there were surveys of, nurses and surveys of hospital workers and different kinds of folks, nobody was talking directly with nursing home residents. And that is really challenging. Many residents have communication problems. Many residents are living with dementia. And so their families really are a day-to-day lifeline, not just for information about what's happening, but families actually often go in and provide care. So all of this got to be very alarming to us. And then, as Anne described, we spent the summer figuring out what's within our wheelhouse that we can do, and came up with the survey. We had some really great colleagues who are experts at creating and fielding surveys. And once we got it out in the field, we were very pleased with the kind of response we got. And we had a lot of help. We got, because again, everybody thinks about how do you survey nursing home residents? It is challenging. So we reached out to all our friends like Consumer Voice, like the National Network of Ombudsmen. And we got a lot of help from ombudsmen, just letting people know that this exists out here. Please go take the survey if you're a nursing home resident. Also, the American Healthcare Association and Leading Age and groups like that work with and represent providers, put it in their newsletters. So we just, called on all our friends and acquaintances and said, please help. We have no funding to do this, but we've got to make it happen. And we were able to get 365 responses, which from 36 states. We were very pleased.
Which I think is fantastic, considering, the fact that residents were so isolated and so many did not have the ability themselves to access technology to use. So I think it was a great response. Talk about some of the examples of questions that you asked of residents, because it was really important to really try to get at what it was that they were experiencing. I know that was a real goal of yours.
Sure. Just one more factor to emphasize before we dive into that, and that is that, as we know, early in the pandemic, it was already clear that nursing homes were being hit really the hardest, and perhaps assisted living facilities, in terms of the vulnerability of residents, and also the exposure, as it turns out, of staff, coming into the facilities who often do work in more than one nursing home in order to make ends meet. And the COVID spread, in facilities was very high, and the morbidity and the mortality rate was very high. So that was a backdrop also for us wanting to take action, if you will, and come up with a survey and then some recommendations. So the kinds of questions that we asked were mainly focused on sort of initially a before and after look, of what was your life like before COVID-19. How many times a week did you go out? Did you have visitors? How many times a week before COVID-19 and then after? So we drew those comparisons, and they were very stark. And that's one reason we wanted to do the survey as quickly as we could, so that people remembered what life was like and could reflect on that, as well as what happened starting really in mid-March or so. And we also asked some questions about staffing and advanced care directives, and feelings about risk, and how many risks residents felt like they wanted to take, and how safe they felt. We asked some questions about technology, since the online world is obviously something that we're using right now and is very important, to people who are isolated, physically. And in order to find out really how wired nursing homes were, and how accessible some of the technology that we love to use is to nursing home residents. So we tried to do quite a bit, really, to paint a picture of life in a nursing home before and then during COVID.
I know, as we were talking, when you were developing the survey, that I think the questions hit on all of the issues that we were hearing from residents, that they were certainly, concerned about, not just what was happening in their facilities, but I think the risk issue was a really good one too, in terms of what they were willing to accept. And we have heard quite a bit from residents, afterwards about the decisions were being made for them. So I think hearing from the residents directly really is very powerful, and so glad that you did the survey. So talk a little bit about what your survey found, and what were some of the results, and what were the residents telling you?
So some of the, I'll start out. got a lot of findings. So we found that 76% were lonelier. I mean, some of these findings are very common sense and not surprising, but it is interesting to have the direct response from residents to build a little bit of data around what's happening. So 76% were lonelier. One surprising finding, at least to me, was that residents were not only restricted from having visitors from the outside, they were restricted to their own rooms. Residents reported not having been able to even leave their room for months on end. They weren't many times allowed to go outdoors. Even in the earlier CDC guidance, outdoors, and this was during the summer months, so quite a nice climate in many parts of the country. Outdoors was one of the safer environments in terms of COVID spread. You had less of the air in a sealed environment where you're just sharing germs, but the outdoors was considered much safer, and residents weren't even being assisted to get outdoors, being allowed to get outdoors, no fresh air for months on end. Residents, a little bit surprising to me, they were not as concerned about their safety in terms of the virus. And that may be partly that staff were doing as best they could, with limited PPE in some cases, but staff were trying to follow protocols and keep them safe. And they felt that they were, the majority felt they were being adequately kept safe from the virus. But other factors were really impacting them. We heard about food quality going down, more stress on staffing levels, because of course, just as residents are impacted by the virus, staff and their families were impacted. And even things like availability of childcare for the staff's children was impacted. So there were more strain than ever on just having adequate staff in the building. So yeah, we also heard from residents in an open-ended question, very poignant quotes and some very touching comments that residents made about what life was like for them. Several of them commented about feeling like this is like living in prison, feeling like they wanted to give up, losing weight. And we found in the literature some newer theories of the use of the term failure to thrive, which is, originally applied to newborn infants and young babies when they're not nurtured and they have some emotionally not cared for, that they have a physical impact. They don't gain weight, they don't eat, they don't respond, they don't develop. And elders experienced some parallel things. The lack of emotional connection and the lack of care for their emotional well-being was causing weight loss, social withdrawal, losing verbal abilities, dementia advancing faster. So those were really surprising and stark findings to me.
Yes, and they seem to be exacerbated, very much so by the long-term isolation that unfortunately was a side effect, if you will, of the pandemic. It's almost as though, the severe isolation that caused severe loneliness and resulted in both physical harm as well as, harm to mental well-being was its own, secondary pandemic is kind of how we think about it inside the nursing home walls.
Right.
So we really very much hope that nursing homes are able at this point and have been for a while to not do that, to have appropriate safety precautions in place and adequate staffing and enough creativity and enough connectivity, to the online world in order to be able to keep residents connected, to their lives, to the people they love, to activities that they've been familiar with. It is the last several years of their lives in many cases, and to have somebody in kind of a jail-like situation is obviously tremendously harmful. And we did actually come across some interesting research. We didn't do it ourselves, but there has been an excess mortality above and beyond what has happened with COVID-19. That's very striking. And some of that may be due to the severe harm from social isolation. And one researcher, Steve Kay in California, has calculated it as 15% higher than otherwise expected, or about 40,000 additional elders. So we need to address this issue of social isolation, which has been with us for a long time in the nursing home setting, just not very noticed. much more systemically and much more thoroughly than we have. And I think COVID-19 has really pointed to that.
Right. I think it's so important that you were able to get this feedback from the residents who were able to tell. And I think, something that you just said, Anne, is in terms of the isolation having been a systemic problem. I think even before COVID, we know that so many residents have been isolated, but and that isolation is a big problem for people. But I think, as with many other systemic issues that we've experienced with long-term care, the one of isolation has really been exacerbated now and had the spotlight shown on it. Because what of the residents who weren't able to respond to your survey? And when you think about the isolation that the people who were experiencing, who were able to respond, you think about all those who weren't, who couldn't do the virtual visitation with their families, for example, or not able to participate even in the limited activities that might have been presented before them. Many didn't have even televisions in their rooms, because if you don't supply one yourself, maybe you don't have one. So it's been really tremendous. And to your point, Sarah, about even like the fresh air, that was one of the shocking things, that people weren't even able to get fresh air. One resident had told us they wouldn't even let her open the window in her room. She was kept in her room and not even able to open the window to get fresh air. So that was really stunning. So, in terms of, the results, I mean, Sarah, you had mentioned, you were surprised by a couple of them. What really were the most surprising results that you think were presented to you based on the research?
Honestly, I was a little surprised at the level of confidence that residents expressed about staff trying to keep them safe from the virus. I mean, good for them. It's a big part of their job. It's not the only part of their job, but that was a little surprising. I was honest, as you just mentioned, the outdoors, I was a little surprised about that. That the interpretation of what was allowable throughout the summer included just, lock it down, not even going outdoors. So those were surprising to me. And as you point out, these are the folks who are able to interact with an online survey and participate in that survey. It's, I think we're going to find even more stark results when people are routinely visiting again, and we can see what's been happening with the folks who have cognitive impairment or some other impairment that kept them from participating.
Yeah.
So that's a little scary.
Yeah, absolutely. I mean, I think the extension even of the failure to thrive, as you both have mentioned, and that impact was really striking as well. The fact that, because we're hearing similar things about the impact on a person's not just physical ability, but cognitive ability as a result of this isolation. We were hearing that a lot from family members also. So, I mean, as you looked at this, I know you were looking at a variety of recommendations and things that that based on what the residents told you, facilities might be able to do, or even policies we might need to think about in terms of how we move forward to prevent this happening again. I think we learned a lot from this, and so what did you, not just from the results, but what are your takeaways? What did you learn, from this in terms of thinking through, okay, if we're ever in this situation again, heaven forbid, we're not even out of it, but, I think we need to be thinking for the future, how we address the issues now, how we address them for the future. What are some of the things that, some of the conclusions you came to?
Well, I'll start. I think that, social isolation has sort of shined a light on the quality of life in nursing homes and how important it is really to elders' health, and also really the emotional health of family members who are trying to support them and living in the community. Quality of life really has always been kind of secondary, I think, to quality of care in the nursing home model of care. And I'm thinking that the pandemic has pointed out that quality of life must be treated as equally important, really. Because if you don't pay attention to it and you do have extreme circumstances like severe social isolation leading to severe loneliness, leading to all kinds of feelings of despondency, physical withdrawal, acceleration of dementia, worsening of heart disease, and so on, then I think we're not doing a good job, obviously, with people living in residential long-term care settings for whom this is their last home. So I think we have a long way to go to address this problem, which has been with us for a while. And there are some things we can do, a lot of things we can do, actually. At the nursing home level, we have been somewhat encouraged to hear that homes that are creative, that do things like, help residents figure out how to eat, not by themselves with the door closed, but maybe at the doorway of their room and being able to see other people at the doorways of their rooms, in their hallways. Something simple like that can make a big difference. There is such a concept in Canada, they call it distance socializing, where you really can arrange for group activities with that social distancing built in. You don't have to just cut it off. So that's been somewhat encouraging. There seems to be a need to report a lot more on social isolation, whether that's ombudsman. I know there are codes, and we're interested in exploring those codes, the complaint codes, and seeing if there are patterns that correlate with not much visitation and poor, quality of care, and to shine a light on that. We're interested in having nursing homes think about assessing residents as they come into a nursing home for the risk of social isolation and the kinds of things they would like to do in order to thwart that. And we're interested in Congress paying more attention to this, and hope they do, as well as, of course, the executive branch, the Centers for Medicare and Medicaid Services. So there really is a lot we can do. And we made a number of recommendations. Those are just a few. In our report, we hope you'll take a look at it. And Sarah, you probably want to say a little bit more about some of the others.
Sure. Yeah. And Anne touched on a really important one, which is just assessing residents. There's a detailed assessment that already happens when someone enters a nursing home, and then it's updated quarterly. There really needs to be more, and CMS could put out guidance and teach homes how to do this. It doesn't just have to be a black box that's mysterious. How to assess for current loneliness, for risk of loneliness, isolation, what kind of connections work for individual residents, and how to plan for that. Make it part of the care plan, not just clinical, how you're managing your diabetes, how you're managing your loneliness, how you're managing your connectedness in the positive sense. So that's very important. We also had some ideas about things, as residents need support and help, those who take care of them also need help and support in order to do a good job of that, in order to be able to address residents' needs, in terms of physical care, but also to connect with residents. So staff need more support. They need, first of all, adequate PPE. If we're in this kind of a pandemic, nursing homes need to be prioritized for that, along with other kinds of providers. But, they need to have the basic equipment. We need basic numbers of staff to be able to perform the tasks, and then be able to spend that little extra time building relationship with residents. We need staff to be supported in areas like their own health and their family's well-being. So they need paid leave if they get sick. They need some sort of support so that their families can be taken care of, so they can come to work. So there's a lot that we can do, both at the individual nursing home level. Nursing homes can adopt some of these just as personnel policies, but also at the bigger level with CMS and Congress looking at how is this type of care actually run, and what can we do at a policy level to make it better. So assessing for loneliness, also assessing for the level of risk. Some people really want to be complete, and this is true of everyone, not just people in nursing homes. Some people really want to be closed off, take the maximum no risk scenario and apply it to their lives and say, I just don't want to have exposure to this virus in any way. And other people feel more like, if I did that, I would suffer too much. I need to mitigate my risk, but I'm willing to take a little risk. Some people are willing to socialize with masks and some distancing. Other people feel like that's too risky. So we need to really, instead of just plunking a one size fits all, or fits no one, frankly, solution onto this, we need to really talk with people and consider their whole person and what kind of risk they're willing to take.
Yeah, that's an important concept, that dignity of risk concept. And we look forward to exploring that further, in work that we do on an ongoing basis. it should be, really up to the individual resident to decide as much as possible, what their tolerance is for certain kinds of risks within, of course, the umbrella of larger community safety, of course. But they do need to, be able to make those decisions for themselves. I wanted to say a quick word on the online communication.
Mm-hmm.
And that's, I think, very important. And I know there's been some freeing up of funding. I believe it's civil monetary penalty funding for tablets and other connecting devices, which is great for residents. And in our survey, we asked, because we really wanted to know, so what's the baseline? And we asked, does your nursing home have access to Wi-Fi? 67% of respondents said yes. We asked residents if they had themselves, their own device or access to a device that the home would lend them. Almost half, 47% said yes. But when we said, okay, so does the nursing home help you, get on to whatever website you're interested in or participate in an activity, have any programming? The answer was either no or I don't know, 45% and 28% respectively. So that indicates there's not much going on in terms of active help and programming by nursing home staff for residents. And that could really change. And we hope that that is one of the things that we can all work on together.
Yeah, absolutely. I think, so many of the points that you've both just made are really important in terms of looking at not only the individual and how they can be assessed and how we can do care planning and provide support for everyone, each resident at the individual level, but we also need to be looking at facility policies and facility activities. I mean, we've seen some great examples of engagement and activities and working to keep residents connected. And so, I do hope that we can learn even from some best practices that have been done well, around the country during this time. Because even as we've talked to residents across the country have had very different experiences with this pandemic. And so there have been some facilities and administrators who have done a good job and others not so much. And so we need to look at them and then again, look at policy issues and how we can support better policies within facilities, both for virtual engagement as well as for in-person engagement and thinking about what that looks like. I know as we're moving through this pandemic, I think we see light at the end of the tunnel, hopefully, that now that vaccines are in place, and but we still got ways to go before we are fully reopened and life is, I guess, semi-quote back to normal, in terms of what that looks like. So so what are your next steps with respect to work in this area? What are you going to be focusing on moving forward?
Well, a couple of different things. We would like to continue to look at the social isolation issue, and we are thinking about looking at the ombudsman data that comes in that you know so well, Lori, and Sarah knows so well, and just trying to see if we can discern a pattern of either improvement or worsening or no change compared to before the pandemic. So we hope to be able to do that. And we also hope to focus a lot on staffing, which I know is a subject that Consumer Voice has been leading the charge on for decades. And it is going to come down to trying to create a better nursing home model of care, we think, that has a more stable staffing model. And there are a number of ways to do that. And, those are all really good policy discussions and sometimes vigorous political debates. But I think that we're going to absolutely have to do it. I think there's an opportunity to do it. In this administration, I believe they're interested. I believe there's a lot of focus on healthcare heroes. We hear about it more in the hospital sector, but we can certainly shine a light on the many healthcare heroes we have in the nursing home sector as well. And really look to trying to improve, the wages of direct care staff, 15 an hour and up, to putting in place training programs that we don't have, and there's no reason we can't have them. They have been developed in many cases.
Right.
And there are a number of other things. And I know that we've done a study that Sarah could talk a little bit about in Michigan that looked at what was going on in the state where we are headquartered, Altarum. So Sarah, you might want to say something about that.
Mhm.
Great. Yeah. So along with another agency called PHI, Altarum conducted a study for state of Michigan about the long-term supports and services workforce in Michigan. And for those of us who've been working in and around long-term supports and services for a long time, not terribly surprising, but as Anne noted, the wages are on average in Michigan about $12 and change per hour. And that varies from minimum wage, essentially, up to about $14 an hour. But that's for an extremely difficult and now dangerous job.
Mhm.
So staff wages are clearly a really important thing. We found a huge majority don't have benefits.
Right.
So their own health care is either dependent on a publicly funded program like Medicaid, or they have none in many cases. They typically don't have any paid leave. So if they get sick, that means the rent isn't getting paid at their apartment or house.
Right.
Not that they just have to go home and be sick. So all those things, the economics really interacts with spreading the virus.
Mhm.
Because we also found that many of these workers in long-term supports and services, they have to work more than one job.
Mhm.
So they have to work maybe some shifts at a nursing home. Maybe they're also working for a home health agency. They're in multiple settings, just magnifies the exposure potentials for the disease, as well as their own economic situations. They're living in crowded housing because they don't have a lot of resources. Their own housing is oftentimes imperiled. Their resources are just so stretched that, when they're hit with a pandemic, they've got the lack of training, they've got the low wages, they've got the lack of benefits. So who could be surprised at the outcomes we're seeing?
Mhm.
So we see a lot of potential. There's a lot of current energy around improving things in this realm, and starting with policies, which is where you go to start. Anne mentioned $15 an hour. That would be a great improvement for many of
Mhm.
these workers. And from there, we've just got to build on strengthening their training, strengthening their ability to safely do this job, both for the person they're caring for and for their own selves, and be able to stay in the job.
Mhm.
And you've got to make the job a quality job that becomes a career, so that people are enabled to provide quality care.
Mhm.
Yeah.
Absolutely. The impact on the staff and the conditions, the working conditions of the staff so directly impact not just the care being provided to the individuals, but their quality of life also.
Right.
And I think your survey showed that. I know certainly we've been hearing that from residents as well, directly from residents as well, about how they were serving as supports for the staff because of the burdens on staff because of short staffing and lack of support and lack of equipment and all of those other things. So we absolutely have to address the issue with respect to staff in order to improve the conditions for residents. They're not
Right.
separate. They're tied together.
Right.
So for the people who listen for this webinar, we've got a range of people who are, family members. We've got people who are interested in policy and in making a difference. I mean, we would encourage people who are concerned about their loved ones, the residents, the staff, to contact not only their ombudsman program to ask for help or file complaints if you're concerned about the care or the quality of life that the residents are experiencing. Also to contact their policymakers about conditions in long-term care facilities and the need to do better. And why don't you give the website address for Altarum where people can find your report so that they can see not only the survey results, but also the recommendations that you have put forward.
So if people could go to Altarum, that's altarum.org/eldercare. They will find our work about the survey, also culture change work that we're undertaking with nursing homes to try to improve the whole environment, and workforce. So all the things we've been talking about. It's altarum.org/eldercare.
Great, thank you. And we will also, I know we do link to the report on our website at theconsumervoice.org, but we'll make sure to put a link to it where we post the recording of our conversation this morning as well. So we wanted to end the conversation with you as we mentioned, as I talked to you before we started on, we have been talking with residents quite a bit about their experiences, and we thought it fitting, since we're talking about the impact on residents, to hear a resident's voice about what the impact has been on her from the isolation. So Katie's going to queue up a recording for us so that we can hear that for just a minute. I think it'll be very impactful for our listeners. Katie, can you cue that up?
When they've been cooped up in a room and can't have anybody come see you. I can't have anybody come see me. I don't get to see my family. I haven't seen my family in months. So I just think it just needs to come out.
Yeah.
I mean, it's not all roses around the door. It's very difficult for us.
I think the message sent by this resident, who is a woman we've had the pleasure to get to know over the past several months, and the experience that she's having, is really telltale for many of the residents that we've talked to and for those that responded to your survey. And we can do better for them, can't we? We can do much better for them.
Absolutely. Look forward to working with you to make that happen. And we
Same
can
here.
And we will.
Absolutely. We definitely can. So for those that are interested in making a difference in this area, I would really encourage you to read the report that Sarah and Anne have worked on, look at the recommendations. And I know we look forward, as we just mentioned, to working with both of you and other colleagues on how we can make a difference and make a better impact for people that are living in these facilities. So thank you so much. Thanks for coming on today and sharing the work that you're doing.
Thank you, Lori. Thank you, Katie. Thank you, Consumer Voice.
Yes, thank you for having us.
Thanks. Great to have you.